What's going on, nurses? Welcome. Hey, today is Monday. Y'all already know what the deal is. Today's Monday, baby, and we doing NCLEX questions. NCLEX questions. I got these questions off nurselabs.com. Welcome. If you guys are just now joining us, you guys already know what the deal. You guys already know what to do. Smash that like button. Make sure you guys share. Make sure you guys follow. You guys already know the deal. Once we get 100 folks up in here, I'm gonna turn this camera around so y'all can stop looking at me. Even though I'm probably the most handsome thing that you've probably seen today. We're gonna turn around so you can look at this handsome computer with these handsome questions. Okay. So hey, make sure you guys like, share, follow. How was you guys' weekend? How was your weekend? I had military drill this weekend, so I got to put on my uniform, play Navy. I want to know everybody else. He's a big Mike says, love your videos. You're getting me through nursing school. My man, that's what I'm talking about. User 14, good night from Montego Bay. You going to bed already? Okay. Hey, if you guys missed these videos, they'll be up on my YouTube channel. So you guys can go over there and check those out for yourself as well. Okay. Hey, so like I said, make sure you guys like, make sure you guys share, make sure you guys follow. That's the three things. That's the trifecta that TikTok likes. Okay. Also, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse at all, let us know what you do. But shout out to everybody else that's not a nurse, like my OTs, my PTs, my patient care techs, all y'all. I love every single one of y'all. Rolled. It says the tie rolled LSU. Oh, did they? I didn't even watch it. It says long simulation lab on Saturday and clinicals on Sunday. Sassy Spoon. Hey, look, I know those feelings. It says, night shift at Cornwall Reed. Okay. All right. Well, hey, have a good shift. Hey, make sure you go out there and you take care of them patients. Okay. Don't forget paramedics. Hey, I can never forget paramedics. Hey, just because I don't say the paramedics in the names doesn't mean I don't care about y'all. You know what I'm saying? But shout out to my paramedics. Shout out to my MAs, my CMAs, all y'all. It says going to third semester in NCLEX, California. Shout out to you. Second to last semester in nursing school. Clinicals at 5:30 a.m. Look, hey, I've been there. Hey, I remember I used to go through like straight. It'd be like work Monday through Friday, have clinicals Saturday and Sunday, turn right back around, go back to work. So I remember I worked so many days straight. And going to clinicals is like going to work. Hey, if you guys are just here, make sure you guys like, share, follow. We're going to do NCLEX questions. As soon as y'all share, the more y'all share and all that good stuff. And TikTok is just like, yo, y'all need to come to this man's stream. Once we get 100 folks up here, I'm going to turn this camera around. But I want to know who you are, where you're from, where you're at in your nursing journey. All right. How was y'all's weekend? All that good jazz. Okay. I want to know. Hey, by the way, 7-day NCLEX course. Hey, I just want to let y'all know pre-launch is going to be over here real soon. It's going to be over real soon, Black Friday. All right, make sure you guys go over there and check that out. Also, I do commercial breaks. If you don't like commercial breaks, that don't mean leave. That means just sit through the commercials, okay? Nick, what's up? How are you? Texas first semester. My wife is an MA, but I think she's burnt out. She's in gastro. I bet she is. They work a lot. Hey, we got 130 people up in here. All right, so I'm going to turn this camera around and we about to get this thing started. All right, we're going to get it started. Sorry if I'm yelling for y'all, but hey, if I yell too much, I don't know what to tell you. At that point. But hey, welcome. We're going to do NCLEX questions. Hey, so this is where we take breaks. This is what the break little sheet will look like. So don't be confused when you see it. Make sure you guys participate. All right. Participation is the key. What's up, Steph? How are you? The trifecta for TikTok. You got to share, you got to follow, and you got to give me all them likes. Don't be selfish your whole life. Hey, if you troll my chat, I'm going to troll you and then I'm going to ban you. Okay. I'm going to ban that ass. So as long as you guys understand that I'm going to ban you, it's not a surprise if you act up in my chat. I'm just letting you know. All right. But nurseslabs.com is where I got these questions from. They're free. You guys can go over there and check them out for yourself. So like I said, 7-day NCLEX course. Right now, it's for a lifetime. It's $48. You can get it for a lifetime. You get all the updates that I'm doing right now. And if you need one-on-one tutoring, you can check that out. Both those links are in my bio. And afterwards, I'm going to do an Ask Me Anything. Essentially, when it goes towards nursing. All right. If you get personal, I may give you an answer too, but we'll see how that goes. All right. Hey, here we go. Question number 1. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysm? Is it DM, HPN, PVD, or syphilis? All right. Hey, those are all acronyms. All right. And you will see these acronyms that'll pop up: diabetes mellitus, hypertension, peripheral vascular disease, and syphilis. All right. Oh, also I'm going to put you guys on a timer because some people are just like, oh my God, you guys take too long. Answer the damn question. So I'm going to give you guys 30 seconds. Hold on. What are we thinking? What are we thinking? Did I say hypertension? What did I say? HP. Oh, no, yeah. Hypertension is HTN. My bad. Sorry. Hey, I'm not perfect at everything, y'all. I'm not perfect at everything. All right, y'all. Here we go. Here we go. Here we go. Here's our answer. Here is our answer. Also, HPN can be hypertension. I had to look that up. You have HPN or HTN. It says you're fine. I just want to make sure I was thinking about it right. Yeah, Michaela, we Gucci out here. We Gucci. All right, y'all. Here we go. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B. So continuous pressure on the vessel wall from hypertension causes the wall to weaken and an aneurysm to occur. The association between hypertension and a AAA could potentially be confounded by other risk factors because hypertension is more common amongst persons with overweight and obesity, less physical activity, who smoke, and who have unhealthy diets. Hey, so I will also label them down here, what section of the NCLEX pie that they are in. They go right here. So this is health promotions and maintenance. It's like 6 to 12% of the NCLEX itself, okay? It says, what are you reviewing? Specialty, I have neuro. This is just a comprehensive exam that I got off of nurselabs.com, okay? So I usually don't do the specifics, but sometimes we'll do the specifics. We'll see how that goes. Makes the walls weak. That's right. Hey, question number 2. Appreciate the participation. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Is it a bruit, crackles, dullness, or friction rub? Hey, welcome to everybody. We're doing NCLEX questions. I got these questions off nurselabs.com, nurseslabs.com. They are free. Make sure you guys smash that like button. Make sure you guys follow and make sure you guys share. Don't be selfish your whole life. Okay. Make sure you guys do all those things. And also, if you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Sure, boy, thank you for the follow. All right, I'm going to give you guys another 10 seconds. Everybody's screaming the answer at me, so I'm going to give some people ample time to answer. All right. About to graduate in May. Shout out to you, Emma. Just graduated. Is it Yasmin or Ismeen? So shout out to you. Just graduated. Congratulations. I know a bunch of folks that are graduating now. And then, of course, come December. All right. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is A bruit. A bruit. A vascular sound resembling a heart murmur suggests partial arterial occlusion. In addition to abdominal palpation, auscultation for abdominal or femoral bruits may be useful for clinical detection of a AAA. Auscultation is performed along the course of the aorta and femoral arteries. However, absence of a bruit does not exclude an aneurysm. So shout out to everybody that picked bruit. That section is the health promotions and maintenance section on the NCLEX, okay? So shout out to y'all. We're going to go on to the next question. Hey, here we go. Question number 3. Which of the following groups of symptoms indicate a ruptured abdominal aortic aneurysm, or I'm sorry, an abdominal aneurysm? Is it a low back pain, increased blood pressure, decreased RBCs, and increased white blood cells? Is it a worsening lower back pain, decreased BP, decreased RBCs, and increased WBCs? Severe low back pain, decreased blood pressure, decreased RBCs, and decreased white blood cells? Or is it intermittent low back pain, decreased blood pressure, decreased RBCs, and increased white blood cells? What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. I got them off nurseslabs.com. These are free questions. You guys can go over there and check them out for yourself. Also, if you're in nursing school and you need to learn about NANDAs and all those things, they have really good sections on how to learn all that good stuff too. All right. If you guys are new here, make sure you guys like, share, and follow. Smash that like button. Make sure you guys share because you never know who's going to need it. Make sure you follow because I mean, I guess you kind of like me, but whatever. Get my RN. Okay, shout out to you 3 days after your birthday. All right, Elizabeth. All right, shout out to you. Get 3 days before your birthday. Congratulations on getting through school as well as happy early birthday. So, Moonstruck says, gotta be C. It just gotta be. It gots to be. All right, y'all, here we go. Here we go. 5 seconds. Here we go. In 3, 2. And the answer is B. Severe low back pain, decreased blood pressure, decreased RBCs, and increased white blood cells. Severe low back pain indicates an aneurysm rupture secondary to pressure being applied within the abdominal cavity. When a rupture occurs, the pain is constant because it can't be alleviated until the aneurysm is repaired. Blood pressure decreases due to the loss of blood. After the aneurysm ruptures, the vasculature is interrupted and blood volume is lost, so blood pressure wouldn't increase. For the same reason, the RBC count has decreased, not increased, and the white blood cell count increases as cells migrate to the site of injury, right? So, hey, physiological adaptation, that is the third largest section on the NCLEX, okay? So just be aware of that, all right? Here we go, on to the next one. Appreciate everybody participating. Welcome if you guys are new. We're doing NCLEX questions. Question number 4. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? Is it a hernia? Is it a stage 1 pressure ulcer? Or is it a retroperitoneal rupture at the repair site? Or is it a rapid expansion of the aneurysm? What are we thinking? Hey, if you guys are just joining, like I said, we're doing NCLEX questions. Make sure you guys like, share, and follow. All right. It says me and my IG. Shout out to you. Appreciate the follow. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, and if you're not a nurse or on a nursing journey, what do you do? And why are you here? You just like the sound of my voice? Do you just want to participate because you want to be cool? Are you the good Dr. Awesomer? Like, what are we doing? What are you guys doing out here? Just finish LVN next month. Oh, I finished LVN. Okay, Miss Duffy, I see you. Been a nurse for almost 2 years. All right, Gabby, I seen you. Hey, by the way, y'all, I've been a nurse for 3.5 years. Worked in the OR, I worked in the ICU, worked in PACU, and worked in OR. So I've been in the Navy for 16 years, still in the Navy. I've been an educator in the Navy for a while. I guess equivalent to an LVN in the Navy for a while, as well as an instructor, and I'm a surgical tech as well. So just a little bit about me, and I'm gonna go ahead and we'll answer this question. We will answer this question in 3, 2, and the answer is C. I work in payroll. I like to learn things. I got you. Tracking. What is it? So the answer is C, the retroperitoneal rupture at the repair site. Blood collects in the retroperitoneal space and is exhibited as a hematoma in the perineal area. This rupture is most commonly caused by leakage at the repair site. Also, when you guys are reading your questions, it doesn't matter what test it is, if you're in school, if it's an ATI, if it's HESI, if it's NCLEX prep, whatever. Make sure you guys are reading your answers. You're reading your rationales and you're reading these on why these are incorrect. All right. Because there are 3 things that you need. You need to have questions with answers and rationales. You need to have content and you need to be able to review all of those. All right. Because when you review or remediate at the end, that is where the information sinks in. OK, but shout out to all y'all. Appreciate everybody being here. We're doing NCLEX questions. Question number 5. Which hereditary disease is most closely linked to an aneurysm? Is it cystic fibrosis? Is it lupus? Is it Marfan syndrome? Or is it a myocardial infarction? It says taking the NCLEX this week, not feeling very confident, thinking about rescheduling. Mrs. Stevens, why? Why are you thinking about it? Why are you thinking about rescheduling? So here's the thing. Hey, put yourself on a schedule, cut people off, recreate the testing center, right? Get yourself the 3 things that you need to do, right? Starting with those areas that you know that you're not the hottest in. Like for me, it was pharmacology, stuff like that. That is how you do it. All right. Same. I'm thinking of rescheduling. Okay. Hey, if you're thinking about rescheduling, what does that tell me? E, all of the above. Really, guy? Really? Michael, you don't even see that on here. Don't reschedule it. You got this. Let them know. Let them know, Toto. Let them know. You don't need to reschedule it, right? Because I'm telling you, you're going to reschedule it, then you're going to keep rescheduling it, then you're eventually not going to take the test, all right? Heart attack are not hereditary. All right, here we go, y'all. Here we go, real quick. Here is our answer. First year nursing student is it C? I don't know. We're about to find out. Allison, let them know. Here we go. Hey, this is what I love. Community, y'all. Community. Here we go. Here's our answer. And the answer is C. It's Marfan syndrome. Marfan syndrome. If I'm saying it wrong, I mean, you can tell me I'm saying it wrong. I'll probably still say it wrong anyway, but there we go. Marfan's syndrome results in the degeneration of the elastic fibers of the aortic media. Therefore, clients with the syndrome are more likely to develop an aortic aneurysm. My goodness, I can't talk today. Marfan syndrome, or MFS, is a spectrum of disorders caused by a hereditable genetic defect of connective tissue that has an my bad. Sorry, y'all. My son is in there screaming. I don't know what he's screaming about. An auto-dominant mode of transmission. The defect itself has been isolated to the FBN1 gene of chromosome 15, which codes for the connective tissue protein. Fibrillin. Abnormalities of this protein causes a myriad of distinct clinical problems, of which the musculoskeletal, cardiac, and ocular system problems predominant. Sure, whatever, all that good jazz. You guys know, you guys love it. You guys understand all this jargon, physiological adaptations, third largest section on the NCLEX. Make sure you guys understand that. All right, here we go on to the next one. Y'all are having a good conversation out here. Hey, real quick, commercial break. Hey, make sure you guys participate. We are doing NCLEX questions. Make sure you guys participate. I'm kind of funny sometimes, but whatever. Make sure you guys share, make sure you guys follow, and give me all them likes. That's a trifecta that TikTok likes. This gets it out to more people. Don't be selfish your whole life. Get it out to folks, all right? Don't troll my chat. You troll my chat, I'm going to ban you. I'm going to give you a 600. And a 600 just means it equals 10 minutes, which is how long I'm going to ban you, which is, AKA for you, it's going to be forever. So don't play with me, okay? Love you. Don't be rude. Got these questions from nurseslabs.com. Make sure you guys go over there and check that out. Those questions are free, okay? 7-day NCLEX course. And if you need tutoring, those links are in my bio. Also, I'm going to do an Ask Me Anything following these NCLEX questions. So if you got any questions, we can talk about nursing. We could talk about, what to expect when in school and what to expect at your first job, whatever, all that good jazz. All right, here we go. Question number 6. Which of the following treatments is the definitive one for a ruptured aneurysm? Is it an antihypertensive medication administration, an aortogram, beta blockers administration, or is it surgical intervention? Scream it at me. Michaela says D, okay. Hey, by the way, becoming a nurse, there is no age limit. I hear some people say, I'm 50 and I'm going back. Okay, Chelsea, you really screamed it at me. Wow. Okay, thanks. Appreciate you. Hey, I just want to let you know, it doesn't matter how old you are if you want to go be a nurse. Doesn't matter. Some people come in here and they're just like, look, I'm 40, I'm 50. Should I go back to school? Of course. What kind of question is that? What kind of question is that? Don't be scared. Hey, don't be scared to go to school. If you're scared, go to church. I'm just letting you know right now. I should just put that on a shirt. I'm 45 and will graduate my ASNMA. Shout out to you, Miss Sassy Spoon. I see you out there. Tina says, D. The more nurses, the better. That would be great, right? Here's the thing. More nurses, the better. If we kept nurses, that would be even better, right? So here we go, y'all. Here we go. Here's our answer. In 3, 2. And the answer, of course, is D. We want to have a surgical intervention. When the vessel ruptures, surgery is the only intervention that can repair it. The technique used for aneurysm surgery have for long been standardized. 95% of aneurysms are accessible via a small, a frontal temporal craniotomy? Centered over the pterion. Only occasional cases, principally aneurysms of the distal anterior cerebral artery and the lower the vertebral-basilar trunk require different surgical approaches. Man, they be like throwing the big words out there. I'm just letting y'all know. So, hey, I ain't a 10-year-old trying to study for a spelling bee, so if I get them wrong, I just want to let y'all know, by the time you guys get to becoming a nurse, a lot of these words you ain't going to say no more. So if you're in school, hey, it's cool. If you're in school, learn it in school. All right, here we go. Question number 7. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Is it cardiomyopathy, coronary artery disease, myocardial infarction, or is it a pericardial effusion? Do you do CCRN material? Gabby, I do not. I only do NCLEX material. Only do the NCLEX materials. That's a good question, though. How we doing? What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. I got these questions off nurseslabs.com. So make sure you guys go over there and check them out for yourself if you guys need them. Also, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Don't be greedy your whole life. Just like me because you feel sorry for me or something, whatever. And also, I want to know who you are if you're new here, who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing? What are you doing? Like, what do you do? Let me know. Hey, by the way, my patient care techs, my LVNs, LPNs, OTs, PTs, everybody that's ancillary services, I fucking love y'all. All right. I love all y'all. So I want to let y'all know y'all are all part of the team and y'all fucking matter. I don't care what they tell y'all. All right, here we go. Here's our answer. Here's our answer in 3, 2. I'm a social media influencer and I like health stuff. Shout out to you, Carly. All right, I see you. The answer is a cardiomyopathy. Cardiomyopathy isn't usually related to underlying heart diseases such as atherosclerosis. The etiology in most cases is unknown. That is part of, I don't know if you guys can see it. It's all the way down there at the bottom. It says reduction of risk potential. That is one of the smaller sections of NCLEX at 6 to 12%, but still very important. I'm sorry, 9 to 12%. So still very important. Those can be one of those sections that can really set you over the bar when it comes to you studying for your exam. Okay. Occupational therapist in a hospital in Kentucky. Shout out to you. It says, wow, I got that one. That's all right, Eric. It's all good. Hey, we can't get them all right. We just need to get enough. We just need to get enough right and know what everybody else knows. That way we can get a license. That's what that means. All right. Here we go. Question number 8. Which of the following types of cardiomyopathy can be associated with childbirth? Is it dilated? Is it hypertrophic? Is it myocarditis? Or is it restrictive? What are we thinking? Hey, super important when you guys read these questions, okay? Apply what you know versus applying what you don't know. Usually when you apply what you know, the process of elimination becomes a little bit easier, okay? And also you read and you remediate and you review your answers with your rationales. That is how your answers stick into that brain of yours. All right. I'm gonna give y'all 10 seconds. Isabel, thank you for the follow. Hey, if I don't see you guys follow me, it's because I'm trying to read but I see it says Demarthil, thank you for the follow. Jonathan, thank you for the follow. Is it Chris and Milan? Thank you for the follow. Appreciate you. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A, dilated. Who gave me a heart? Who did that? I got to go back up. I didn't see it. I'm sorry. All right. So the answer is A. Although the cause isn't entirely known, cardiac dilation and heart failure may develop during the last month of pregnancy of the first few months after birth. The condition may result from pre-existing myopathy, not apparent prior to pregnancy. That's part of physiological adaptation. Somebody gave me a heart. I don't know who you were. Let me go back up because I gotta give y'all some love for whoever gave me that heart. Is it Alsar? Alsar, thank you for the heart. AM, thank you for the heart. Appreciate y'all. Hey, we're gonna go on A, physiological adaptation. Third largest section on the NCLEX, 14 to 17%. Okay, here we go. Question number 9. Septal involvement occurs in which type of cardiomyopathy? Is it congenital, dilated, hypertrophic, or restricted? By the way, I got these questions off nurseslabs.com. You guys can go over there and check that out for yourself. Also, if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse or on that journey to become a nurse, what are you doing with your life? What you doing? Tell me. All right, I'm going to give you 20 seconds. Milan says, I don't know. That's okay, Milan. I'd rather you guess than you not do nothing at all, right? If you at least guess, you get a 25% it's 25% chance that you'll get the answer right. I'm a veterinarian nurse. Oh, okay. I'm a nurse and I don't even know. That's okay. Hey, we don't know it all. We just got to know enough. ER tech, soon to be a nurse. Shout out to you. All right. I'm a pharmacist. Okay. Certified legal drug dealer. I see you, Presh. I see you out there. Retail manager, expand personal knowledge. Okay, shout out to you. I'm a pediatrician resident. Shout out to you. Medical coder. Okay, I'm taking health assessments. Hey, you right at the beginning. Does somebody say I'm in Ottawa, Canada? Did I see that? An echo sonographer? Shout out to you, Sam. I know a couple of folks that do that. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is C. It is hypertrophic and hypertrophic cardiomyopathy. Hypertrophy of the ventricular septum, not the ventricle chambers, is apparent. Hypertrophic cardiomyopathy is a genetic cardiovascular disease. It is defined by an increase in left ventricular wall thickness that is not solely explained by abnormal loading conditions. I said abdominal so much with the aneurysms, it's weird. This disorder is caused by a mutation of cardiac sarcomese protein genes and is most frequently transmitted as an autosomal dominant trait. Okay. Hey, physiological adaptation. Like I said, third largest section on the NCLEX. And if these things aren't familiar with you, just go back to your cardiac section and just read up on it. I didn't say read up on it forever, but just read up on it so you guys can get a little bit more familiar with it, especially if you guys are getting ready to take your exam. Okay. Hey, there we go. Appreciate everybody participating. Question number 10. Which of the following recurring conditions most likely occurs in clients with cardiomyopathy? Is it heart failure, diabetes mellitus, myocardial infarction, or pericardial infusion? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys like, share, and follow. Home health for 25 years. Hey, for a home health of nurse of 25 years. Hey, so be careful. Hey, I want everybody to know. I want y'all to be careful out there because especially if you're going into people's homes, if you guys haven't read those articles about, people trying to, people essentially unaliving nurses as they go into their homes to take care of people. Make sure you guys take care of yourselves when you guys are out there and be, stay frosty, be vigilant. All right. Always protect yourself. Okay. Helen says, I just got my license. Shout out to you, Helen. Shout out to you, Helen, Miss Chavez. We see you out there. You just got your license. So that means you just found out that you passed. So everybody stop what you're doing and give Helen some love right now. Tell her that you're proud of her. Tell her congratulations and tell her welcome to the shit show, the greatest one on earth. All right. Hello, I'm San Francisco paramedic. Shout out to you. Shout out to you. Congratulations, though, for real. Welcome, welcome, welcome. Make sure you go out there. You do great things. Always take care of yourself. All right. You are priority number one. All right. But also make sure you take care of those patients when you get out there. OK. What kind of nurse are you also? And what type of nurse do you want to be? Pediatrics. And what type of nurse are you? Are you an LVN, LPN, RN? What are we talking about, Helen? All right. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A. It's heart failure. Because the structure and function of the heart muscle is affected, heart failure most commonly occurs in clients with cardiomyopathy. Heart failure can occur when the heart muscle is weak or when it is stiff and unable to relax normally. Cardiomyopathy, which means disease of the heart muscle, is one of many causes of heart failure. Why are T's required? You're essentially saying why are like T's, why is HESI and stuff like that required? Tracy's retired nurse. Shout out to you, Tracy. Darren's a retired nurse. Okay. All right. I see you out there. So those exams essentially are to keep people out. That's why those things are there. Like the entrance exams, the prerequisites. They want to know if you're serious. All right. Here we go. Real quick commercial break. We're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys participate. That is the key because, that's the only way I can communicate with y'all. Make sure you guys share, follow, and give me all them likes. That is the trifecta that TikTok wants. Make sure you guys don't be selfish your whole life. You know what I'm saying? Don't be selfish. I'm out here giving y'all this. Y'all make sure y'all give it to somebody else, baby. You know what I'm saying? Don't troll my chat. You troll my chat, I'm going to ban that ass. Literally, it says, I'm going to ban that ass. Obviously, I had to put the money signs because, we make money out here, you know what I'm saying? Don't be rude. 7-day NCLEX course. And if you need tutoring, you guys can check those links out in my bio. Also, like I said, I got these questions off nurselabs.com. You guys can go check those out for yourself. And we're going to do an Ask Me Anything after this, all right? Ask me anything in regards to NCLEX questions or in regards to nursing, whatever, all that good jazz. Here we go. Question number 11. Kat, wait, whoa, hold up, pause. I heard Kat said, Kevin, I passed my NCLEX. Girl, that's what I'm talking. Everybody stop doing what you're doing right now. And y'all give Kat some love right now. Y'all tell Kat y'all proud of her. Y'all tell her congratulations. Tell her welcome to the greatest shit show on earth. Y'all let them know this is what we do community wise. We uplift each other because Lord knows we already got a bunch of craziness going on as nurses. So we welcome that. Congratulations. Congratulations, Kat. What kind of nurse are you and what kind of nurse are you going to be? Let us know down in the comments. What is the term used to describe an enlargement of the heart muscle? Cardiomegaly, cardiomyopathy, myocarditis, or is it pericarditis? Who said hi to me? Who said hi? Coach Yvonne, hello, what's up? Everybody screaming A. I got some B's out there. Okay. All right. Shout out to y'all. Yo, hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. And here's our answer. Here is our answer. Candy says, I'm a NICU nurse. Shout out to you. Here we go. Here's our answer in 3, 2. And the answer, of course, is A. I can't say of course because some people don't know, but we're talking about cardiomegaly. Cardiomegaly denotes an enlarged heart muscle. The most critical pathophysiological changes leading to cardiomegaly include dilated hypertrophy, fibrosis, and contractile malfunction, contractile dysfunction, and abnormal myocardial remodeling can lead to hypertrophic cardiomyopathy or dilated cardiomyopathy. Mechanical stretching, circulating neurohormones, and oxidative stress are significant stimuli for the signal and transduction of inflammatory cytokines and MAP kinase in cardiomyocytes. I'm not reading the rest of that, but y'all get it. Cardiomyopathy, enlargement of the heart. Boom. All right. Hey, I've seen a bunch of people in the ICU that actually have this, right? And it's very apparent on a regular chest x-ray, right? And it says megalo, think big like megalodon, right? There you go. Or like Megatron. Megatron is a Decepticon, which is a really big robot, right? So you could think about it like that. That was one way that I thought about it as well. But shout out to the nursing students. Shout out to all y'all. Here we go. Question number 12. Dyspnea, cough, expectoration, wow, weakness, and edema are classic signs and symptoms of which of the following conditions? Is it pericarditis, hypertension, obliterative, or restrictive? Man, I'm over here having a hard time reading these. All right, what are we thinking, y'all? What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. You guys can go over there and check them out for yourself. They are free, nurseslab.com. But what I want for you, I want to know who you are, where you're from, where you're at in your nursing journey. And I need for you to smash that like button, like, share, and follow, because that's the trifecta that TikTok wants and I need, baby. Come on. All right. I'm going to give y'all 10 seconds. I got some A's, mostly A's. I see some B's out there. No nickname says it's A. Hey y'all, what's up, Heather? All right, y'all, what are we doing? Thank you for helping me pass my NCLEX in 85 questions. Georgie, you passed your NCLEX. Everybody stop. Hey, and I want everybody to say it like in quotes, like in like Pennywise off of It, saying, hey there, Georgie, congratulations on passing your NCLEX. Shout out to you, Georgie. Shout out to you. Everybody stop what they're doing. Y'all already know what the deal is. Give Georgie some love. Welcome, Georgie, to the greatest shit show on earth, known as being a nurse. Congratulations, Georgie. Welcome. I know it was very hard, some tough work going on there, but hey, you are here with us, and congratulations to you. What type of nurse are you, and what type of nurse are you going to be? So, not a nurse, but a vet tech. Shout out to you for my vet techs. I love it. Hey there, Georgie. That's what I'm talking about. Here we go, y'all. Here's our answer in 3, 2. And the answer is D, restrictive. These are the classic symptoms of heart failure. Heart failure is the pathophysiologic state in which the heart, via an abnormality of cardiac function, fails to pump blood at a rate, commensurate? Why do they use stupid words like that? With the requirement of the metabolizing tissues, or is able to do so only with an elevated diastolic filling pressure. Physiological adaptation, third largest section on the NCLEX. Remember, it's very important that you read your rationales, whether you got it right or whether you got it incorrect, all right? Because that is how you solidify and you hold in information. Can you become an online nurse? What do you mean, can I become an online nurse? You got to give me a little bit more context. Is it Gaziana? Did I say that right? I probably didn't say that right. You got to let me know what you mean. Not a nurse, but I do have my PhD in Grey's Anatomy. Kelsey, stop it. Stop. Are C and D actual answers on NCLEX? Yeah, you never know. Honestly, Georgie says, thank you. I'm now working in a pediatric ICU. Good luck to you all in your exam in school. Georgie, congratulations. Hey, go out there, pediatric. Take care of them babies. Take care of them. All right, here we go. Question number 13. Which of the following types of cardiomyopathy does not affect cardiac output? Dilated, hypertrophic, restrictive, or obliterative? Nursing student here in my second semester. Shout out to you, Jason Xavier. Shout out to you, sir. All right, y'all. Hey, if you guys are new here, welcome. We are doing NCLEX questions. I want to know who you are, where you're from, where you are at in your nursing journey. All right. Make sure you guys smash that like button. Make sure you guys share, and make sure you guys follow. All right. That's what TikTok wants. That's what I need. I'm just saying. I'm just letting y'all know out here. That's how we do. Hey, a little bit about me, y'all. I failed my NCLEX 3 times. Yeah, I bet y'all didn't know that, huh? Joyce, thank you for the follow. I failed my NCLEX 3 times, y'all. And none of y'all would have ever known that unless I told you. Just letting you know. All right? Because I'm telling you, this test doesn't define the type of nurse that you're going to be. All right. I could have just said fuck it a long time ago and be like, nope, I'm not doing this, but I enjoy doing this. Right. That's why I do it. So don't let a test determine what type of nurse that you're going to be, because no one will ever know and no one will ever care. All right. Here we go. There's our answer. Here's our answer. It is B. It says, wow, what did you do differently to pass? Chelsea, I got that. That would take a long time for me to tell you. Wow, you're so real for that. What, for me to tell y'all? Dead ass. I'm an ICU resident. My goal is L&D. I failed twice. Shout out to you, Helen. Hey, I'm from Jamaica, RN student. Okay. I see you, Joelle. I see you. I see you. Can you be what is a WFH nurse? Like a work from home nurse? Absolutely. You sure can. You sure can. They have all different types of online freaking nursing jobs. Like you can work for insurance companies. You can work for medical devices companies. They have a lot of non-traditional nursing jobs out there. But I'm telling you right now, Google University will tell you all that. No lie. Taking NCLEX next month. Shout out to you, ma'am. Shout out to you. Hey, so hypertrophic. Okay. I'm not going to read this. I've been talking about it the whole time. Physiological adaptation. Okay. There we go. Here we go. Question number 14. Which of the following cardiac conditions does a fourth heart sound indicate? Is it dilated aorta, normally functioning heart, decreased myocardial contractility, or failure of the ventricle to eject all the blood during systole? What are we doing? What are we doing and what are we thinking? It says, thanks, I'm going to check it out. Yeah, for sure. You're very welcome. Hey, if you guys are new here, we're going over nursing questions, NCLEX style questions or NCLEX questions off nurseslabs.com. So make sure you guys go over there and check that out for yourself. Make sure you guys like, make sure you guys share, make sure you guys follow. I want to know who you are, where you are from, and where you were at in your nursing journey. All right, I'm going to give y'all about another 20 seconds. But to follow on what somebody said, yeah, I have no problem telling anybody that I failed, because your opinion of me that's a personal problem. That's your problem, not mine. But the reality is nobody cares. Nobody cares how many times you take this exam, as long as you pass it and you get a license. You have no idea? That's okay. I'd rather you guess. I'd rather you guess. Amber, appreciate the follow. Thank you. All right. All right. I also failed my senior year of nursing school, but I'm back, baby. Baby, that's what I'm talking about. That's what I'm talking about. Because guess what? Your journey is your journey. You know, you're the one who's walking and nobody's walking it with you. They may walk beside it, but they're walking their own. You know what I mean? So, hey, get out here and do what you need to do for yourself. All right. And don't let a test determine how you're going to walk through the rest of this life. All right. Here we go. Here we go. Here's our answer in 3, 2. And the answer is D, failure of the ventricle to eject all the blood during systole. And S4 occurs as a result of increased resistance to ventricular filling after atrial contraction. This increased resistance is related to decreased compliance of the ventricle. That is part of physiological adaptation, which of course is the third largest section on the NCLEX. I'm going to start asking, hey, what section? Or what section is it? The first, the third, the second largest? Which one? I'm going to start asking y'all that. I want y'all to know, because that's very important for you guys to know. All right, here we go. Appreciate all the participation. All right, here we go. Question number 15. What is it? I went with my first instinct. A says, dropped out of nursing school twice and I graduated in April. That's what I'm talking about. Look at that. Dropped out twice. And you know, that's a story to tell. That is a story to tell somebody. You dropped out twice. I can't even tell y'all how many tests I failed in nursing school. But guess what? No one cares. Here we go. Question 15. Which of the following classes of drugs is most widely used in the treatment of cardiomyopathy? Is it antihypertensive? Is it beta blockers? Is it calcium channel blockers? Or is it nitrates? What are we thinking? Got D, B, and A. Okay. All right. Hey, if you guys are new here, welcome. Welcome. Doing nursing questions, NCLEX questions off nurselabs.com. Make sure you guys go over there and check that out, okay? B minus D are equal A. What? Can be B or A. Well, you can only give me one. There can only be one. I don't know what happened to this dude. He's screaming. Wait for it. I swear, it's like he stands by the door. He's like, Dad, I know you're in there. And I'm going to scream every single time. He doesn't do it on the weekend. He just does it when I'm on here. I think he just wants to be around y'all. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, beta blockers. It says by decreasing the heart rate and contractility, beta blockers improve myocardial filling and cardiac output, which are primary goals in the treatment of cardiomyopathy. That is pharmacology or pharmacological and parenteral therapies, which is the second largest section on NCLEX. It says Who's that? Is like, he's so spoiled. Man, look, he really is. Damn, I should have known that one. That's Cat. That's okay, though. That's okay. Remember, we ain't going to get them all right. We ain't going to get them all right. We just got to get enough. They just got to get enough to pass. That's it. Hey, real quick, commercial break. Hey, we're doing NCLEX questions. Make sure you guys like, share, and follow. Participation is the key, baby. Make sure you guys share, like, and follow. Make sure you guys follow. All right, because I'm kind of cool sometimes. Don't be selfish your whole life. Don't troll my chat. Nobody's trolled my chat tonight. I'm kind of sad about that because I'm kind of petty and I like banning people. Anyways, so there's that. Nurseslabs.com. That's where I got these from. Okay, 7-day NCLEX course, and of course, if you need help with, if you want tutoring for NCLEX, hey, those links are in my bio. Also, we're gonna do an AMA after this. All right, here we go. It says, "Are you from Louisiana?" Kim, I'm not. I'm from Texas. That felt good to say to you, and I don't know why. Are you from Louisiana? Because if you are, that's for you. It says, "My babies are twins, can cry for no reason." Yeah, because that's just what babies do. They just cry for no reason. Here we go. Honey, a 23-year-old client complains of substernal chest pain and states that her heart feels like it's racing out of her chest. She reports no history of cardiac disorders. The nurse attaches her to a cardiac monitor and notes sinus tachycardia with a rate of 136 beats per minute. Breath sounds are clear and the respiratory rate is at 26. Which of the following drugs should the nurse question the client about using, right? Are they barbiturates, opiates, cocaine, or benzodiazepines? I just started Foundations of Nursing. I'm struggling. Batty, let me tell you something, Batty. I bet you're getting humbled. Hey, first semester of nursing school will humble that ass real quick. It will humble you. All right, so the one thing I'll tell you is time management is your best friend, and then find good people to be in a study group with, divide it up by 25%, and then pull it all together. 25% of the work will give you 100% of the benefits. It says, read the question first. You could skip the stem and go right to answers. Yes. No. Wait, what? What'd you say? It says, read the question first. You could skip the stem and go right to the answer. I don't ever recommend anybody skipping the stem of anything. Read it from top to bottom. Batty, you're welcome. It says, I got into my LPN program and BSN program. Shout out to you. All right. I recommend reading that whole question. If you don't understand it, read the question again, and then go down and read your answers. That way, because your answers will most definitely be able to can definitely help you understand what the question is. But here we go. Here's our answer. Here's our answer in 3, 2. And the answer is cocaine. Baking soda. I got I'm sorry. Here we go. Because of the client's age and negative medical history, the nurse should question her about her cocaine use. Cocaine increases myocardial oxygen consumption and can cause coronary artery spasm, leading to tachycardia, ventricular fibrillation, myocardial ischemia, and myocardial infarction. All right, I was right. Yeah, Queen, you were right. Med bitter, what are you talking about? What'd you say no for? What'd you say no? Hey, that's part of pharmacological and parenteral therapies. Remember, it's the second largest section on the NCLEX exam. Hey, so just like Rick James said, cocaine's a hell of a drug. So kids out there, don't do it. Don't do it. Here we go. Question 17. A 51-year-old female client tells the nurse in charge that she has found a painless lump in her right breast during her monthly self-examination. Which assessment finding would strongly suggest that this client's lump is cancerous? Is it A, a version of the right nipple and mobile mass? Is it non-mobile mass with irregular edges? Is it mobile mass that is soft and easily delimited? Or is it D, non-palpable right axillary lymph node? What are we thinking? I'm pretty sure I said that name wrong. Is it true the NCLEX is being restructured? Whitney, the NCLEX is already being restructured. The NCLEX is actually being restructured all the time. But the biggest thing that happened was April 1st. They went from a different system they went to the new generation NCLEX, where the delivery of the questions are different, but the content is still relatively the same. The biggest thing that they added were case studies. That's the biggest thing, where they give you everything that you possibly could want. All right. I'm going to give y'all 15 seconds. You're welcome, Whitney. No problem. Hey, make sure you guys like, share, and follow. If you guys are new here, we're doing NCLEX questions. I got them off nurselabs.com. By the way, 60 to 70% of your NCLEX are going to be multiple choice and select all that apply. I'm just letting you know, I take my NCLEX on Wednesday. Brianna, shout out to you. I expect for you to be here on Friday to let us know how you did and how you passed. That way I can give you a shout out. I want you to let everybody in the world know that you passed. I'm going to let everybody know, at least all 105 people that are here. So here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is B, non-mobile mass with irregular edges. Breast cancer tumors are fixed, hard, and poorly delineated with irregular edges. That's part of health promotions and maintenance. It says you get the results that fast. You can get the result. It all depends on your state. You can, some states will give you the results same day. Usually you're going to wait about 48 hours. In Texas, it's a 48-hour wait. And I think I have a friend who was in Wisconsin, and I believe she got her results, I think, the same day. I don't know about Tennessee results. I'm not from Tennessee. So, hey, so health promotions and maintenance, y'all. All right, here we go. Question number 18. Shout out to all 100 of y'all that are in here rocking with me. We're doing NCLEX questions if you guys are new here. We have a 35-year-old client with vaginal cancer. Asked the nurse, what is the usual treatment for this type of cancer? Which treatment should the nurse name? Surgery, chemotherapy, radiation, or immunotherapy? What are we thinking? It says the friendly HIV lady. Okay. Yes, ma'am. You're welcome, friendly HIV lady. Everybody's screaming B at me. Thank you for the follow, by the way. Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurselabs.com. Make sure you guys like. Make sure you guys share. Make sure you guys follow. Oh, what was the last answer? I missed it. Ma'am. Hey, just like NCLEX, Megan, we don't go back. We can't go backwards because when you take NCLEX, they won't let you go backwards. So we can't go backwards. I don't even remember what it was. I'm pretty sure it was in an irregular shape. There you go. Irregular and fixed. There we go. See, that's what the chat is. Hey, they're there to back me up. I love it. All right, y'all. 10 seconds. 10 seconds per. You cold? That will depend on the stage of cancer, I'm thinking. Yep. Remember, so this is generalized. Just generalized. Paying attention. Appreciate you. Appreciate you. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C, radiation. The usual treatment for vaginal cancer is external and intravaginal radiation therapy. I was about to say vascular, but there you go. Megan, you're welcome. Well, not really. I couldn't go back. You know, whoever the friendly HIV lady, you know, she put you on. She lets you know what's up. So, hey, physiological adaptation. All right. That is this third largest section on the NCLEX. OK, be aware of that when you guys are studying. Here we go. Question number, he says, yeah, got it right. Shout out to you, Mackenzie. So question number 19. Christina undergoes a biopsy of a suspicious lesion. The biopsy report classifies the lesion according to the TNM staging system as follows. Was it the TIS, the N0, M0? What does this classification mean? Is it A, no evidence of primary tumor, no abdominal regional lymph nodes, and no evidence of distance metastasis? Is it a carcinoma of C2, no abnormal regional lymph nodes, and no evidence of distant metastasis? Is it C, can't assess tumor or regional lymph nodes and no evidence of metastasis? Or is it D, carcinoma of C2 or C2, no demonstrable metastasis of the of the regional lymph nodes and ascending degree of distant metastasis? What are we thinking? Oh, who is that? Is it Kirsty? Kirsty says A. Okay. What else we got? What else we got? I'm gonna give y'all like another 20 seconds. See what we're thinking. All right. Shout out to all 91 of y'all up in here rocking with me. If you guys are new here, we're doing NCLEX questions. Make sure you guys like, make sure you guys share, and make sure you guys follow. That's the trifecta that TikTok wants and TikTok likes. And that's what I need in order to get out to people. So don't be selfish your whole life. All right. And if anybody's wondering what a carcinoma of C2 is, it's a group of abnormal cells that haven't spread from the location where they were first formed. OK, so it's a big cancer question. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2, and whoops. And the answer is B. It is B. The TIS or an N0, M0 denotes carcinoma. In C2, no abnormal regional lymph nodes and no evidence of distant metastasis. All right, reduction of risk potential. It's okay. It's okay, Kirsty. It's all good. I should have stuck with my first answer. Hey, so that's something I'm going to tell you guys. Usually your first answer is your right answer. Don't ever change your answer unless you can 100% articulate to me why that answer that you're changing it to is the correct answer. And then also RTFQ. If y'all don't know what RTFQ, hey, as a matter of fact, tell me what you think RTFQ is. That way I can let y'all know, hey, this is what it is. Sitting in place. There you go. Here we go. Here we go. Shout out to all y'all. Question number 20. Lydia undergoes a laryngectomy to treat laryngeal cancer. When teaching the client how to care for the neck stoma, the nurse should include which instruction? Keep the stoma uncovered, keep the stoma dry, have a family member perform stoma care initially until you get used to the procedure, or keep the stoma moist. Man, I know some people don't like that word moist, and all I want to do is just say it. I'm not going to do y'all like that. Hey, but welcome. If you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. I want to know who you are, where you're from. Moist. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse on that journey, moist. If you're not a nurse on that journey, who are you? What do you do? What are you doing here? Appreciate having you here. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. That is the trifecta. The trifecta. Also, we're going to do an Ask Me Anything after this, probably for about a half an hour. I always get held hostage every time people start asking me questions. So, all right, y'all. 10 seconds. I'm just a server and know nothing about any of this. Amber, that's okay though. Nursing student, going to change the world. Haha, big dreams. Keep those dreams alive. Keep those dreams alive. I'm not going to be one to crush your dreams. However, I will be a realist and I will let you know what it is like out here. So my biggest thing is you got to have a plan so you can navigate through this nursing world. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is D, keep the stoma moist. Future NP of infectious disease. I love that. I love that for you. Like, I like infection control. Like, it's really cool. And disgusting. The nurse should instruct the client to keep the stoma moist, such as applying a thin layer of petroleum jelly around the edges because a dry stoma could become irritated. All right. It says, happy lady, I'm an RN. I work and utilize. Oh, happy lady. Look, I was looking at trying to get a job as a utilization review nurse. And I'm all for it. I'm all for sitting at home doing it. Hey, I might just send you a message and be like, look, hey, send me that resume so I can copy it. Disgusting for sure. I like wound care too. Yeah, you would be one of those. Ew, disgusting. Hey, reduction of risk potential. Okay. All right, here we go. Hey, real quick. We're doing break time. We're doing NCLEX questions. All right. Participate. That is the key, baby. That is the key. All right. I'm kind of funny sometimes, but whatever. Make sure you guys share. Make sure you guys follow. Give me all them likes. Okay. Don't be selfish your whole life. Hey, don't troll my chat. I haven't had to ban nobody and I'm a little sad about that. But anyways, don't troll my chat or I'm going to ban you. Okay. Don't be rude. Nurselabs.com is where I got these questions from, so you guys can go over there and check them out for yourself if you need it. Also, 7-day NCLEX course. That's a course I created, and it's a course that it's very near and dear to my heart. It's $48 right now for a lifetime. It is going to change. It is going to change on Black Friday. I'm telling y'all that right now. So go over there and get it for a lifetime before it goes away. Even if you feel like you don't need it, go over there and get it. Somebody else may need it. All right. If you also want tutoring, I can tutor you one-on-one on NCLEX, right? We can break down questions together. We can go over a review. We can go over studying. We can do whatever. Also, we're going to do an Ask Me Anything after this, all right? So make sure you guys stick around and ask me your questions. Here we go. Question number 21. A 37-year-old with uterine cancer asked the nurse which is the most common type of cancer in women. The nurse replies that it's breast cancer. Which type of cancer causes the most deaths in women? Is it breast cancer, lung cancer, brain cancer, colon, and rectal cancer? What are we thinking? Shout out to all 73 of y'all. Hey, I just want to let y'all know at peak, we had like 600 people in here. So I appreciate y'all rocking with me and staying in here. All right. I want to know who you are, where you're from, where you're at in your nursing journey. If you guys are new here, also smash that like button and share and follow. It says read question. You can answer it without the stem. Yep. Oh, I see what you're saying. If you read the question, you don't trust you on this. Look, I don't trust people as far as I can throw them. I don't know you, and I don't know what size you fit into that demographic, but I'm kind of weak, so I can't throw nobody, so I don't trust nobody. But one thing I will say is that read the question. A lot of times you can read the question, answer it in your head, and then the answer will pop out right there in front of you. All right. So RNMD, right now what? No, I'm just messing. I know what you're talking about. Hey, but remember, everybody learns differently. So it doesn't apply to everybody. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is B, lung cancer. Lung cancer is the most deadly type of cancer in both men and women. Huh, who would have thought? Who would have thought? Physiological adaptation, third largest section on the NCLEX exam. All right. Make sure you guys are paying attention to that. All right. Apply what you know versus applying what you don't know. All right. Shout out to all 80 of y'all in here. All right. Here we go. Question. Let me back that up so everybody can see it. Question number 22. Antonio with lung cancer develops Horner's syndrome when the tumor invades the ribs and affects the sympathetic nerve ganglia. When assessing for signs and symptoms of this syndrome, the nurse should note what? Hold on a second. Meiosis, partial, what is it? Eyelid, ptosis, and I'm not reading the rest of that. Like, I don't even like the way those words are because I already know I don't know how to say them right. So, there's that. Dr. Awesome says B. I know my doctor. I know all my doctors, my physicians are out there. They're like, man, those words are easy. The lies you tell. The lies you tell. That's like me saying aluminum versus aluminium. No one says that. No one says that. Hey, if you guys are new here, I want to know who you are, where you're from, where you are at in your nursing journey. All right. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We got A's, we got C's, we got B's. Okay. No clue. Okay. C for fun. I like that. I'd rather you guess than not do it at all. Right. Nope. Keep trying. Yeah. No, I'm not that kind of doctor. He's like, I'm not that kind of doctor. I got you. Oh, PhD doctor, still a doctor nonetheless. You're not a medical doctor, but you know, you're a doctor of philosophy. So still a doctor nonetheless. And the respects are paid to you. So that's just kind of how it goes, you know. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is A. Meiosis, partial eyelid, ptosis, and angiodrosis of the affected side of the face. Horner syndrome, which occurs with a lung tumor invades the ribs and affects the parasympathetic nerve ganglia. It's characterized by meiosis, partial eyelid, ptosis, and the angiodrosis on the affected side of the face. Classic, right? All right, here we go. Physiological adaptation, third largest section on the NCLEX. Pinpoint on lack of sweat. Tracking. Gotcha. Here we go, y'all. Here we go. Appreciate everybody hanging out and rocking. Hey, just let you know, we're doing NCLEX questions if you guys are new here, all right? Make sure you guys participate. Here we go. Question number 23. Vic asks the nurse what PSA is. The nurse should reply that it stands for what? Is it prostate-specific antigen, which is used to screen for prostate cancer? Is it protein serum antigen, which is used to determine protein levels? Is it pneumococcal strep antigen, which is a bacteria that causes pneumonia? Or is it, what is it? I'm just going to say pap smear specific antigen because I'm going to mess that word up, which is used to screen for cervical cancer. It says foreign nurse studying for the NCLEX in the U.S. I want to know how to say your name so bad. Is it Nadaji? Nadaji. Is that how I said it? Give me a thumbs up. Like, give me like a million thumbs up if I said it right. Nadaji. Did I say it right? All right, y'all. 15 seconds. Maybe. What are we thinking? What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys go over there and check them out for yourself. They are free questions, all right? Make sure you guys like, share, and follow. All right, here we go. Here we go. Here we go. Here we go. Here's our answer. Our answer in 3, 2. And the answer is A. It is a prostate-specific antigen, which is used to screen for prostate cancer. Kim, thank you for the follow. PSA stands for a prostate-specific antigen, which is used to screen for prostate cancer. So shout out to everybody that got that question right. Part of reduction of risk potential. Remember, there are 8 sections of the NCLEX client needs, okay? And that is one that is anywhere from 6 to 12% or 9 to 12%. I can't really remember right off the top of my head, but it's very important section that we need to know, all right? So here we go. Question number 24. What is the most important post-operative instruction that Nurse Kate must give a client who just returned from the operating room after receiving a subarachnoid block? Is it A, avoid drinking liquids until the gag reflex returns, avoid eating milk products for 24 hours, notify a nurse if you notify blood in your urine, or remain supine for the time specified by the physician? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. I want to know who you are, where you're from, where you are at in your nursing journey. If you're not a nurse or on that nursing journey, what do you do? I know I got a couple doctors up in here. So I've had some occupational therapists. I think I had a biomedical engineers up in here. I had a whole bunch of folks up in here. Everybody screaming D at me. Somebody said something about it's HESI. I'm about to sit for the NCLEX, but I have ever done HESI specific. What? I don't know. I'm misreading it. And it's going by pretty fast. All right, y'all. Here we go. Here we go. Here's our answer. Our answer in 3, 2. And the answer is D, remains supine for the specific time, for the time specified by the physician. The nurse should instruct the patient to lie supine, right? Remember, when you guys are studying for your NCLEX, you guys are going to read your questions, read your rationales. That is how you are able to retain that information. Content, questions, answers, rationales. I'm about to sit for my NCLEX, but I have only done HESI specialty exams. Oh, so they have comprehensive exams with the HESI, because I had HESI when I was in school too. Should I went with my first instinct? Absolutely. Never change your answer. Never change your answer unless you 100% can articulate it, okay? Articulate it like, yeah, I need to change it. I want to know how similar they are. In my opinion, the HESI questions, I didn't like HESI at all. The HESI didn't help me, like not one bit. I thought their questions were terrible, but that is me. Other people could tell you that they love HESI, just like other people will tell you about ATI. Anytime the orders for the physician, is that probable? It depends. It depends on what's going on with the patient, honestly. It really depends on what's going on with the patient. If there's enough evidence that's in the stem of the question to warrant calling the physician, yes. But if there's not, then you have, as a nurse, have to do your assessment. Okay? And that usually is what the answer is. It says, about to take my HESI and I'm super worried. Why, Madison? It says, I didn't pass the HESI, but I passed the NCLEX. I too hate the HESI. I hate that. I hate everything about HESI. Just like everybody hates everything about ATI. I hate it. All right. A male client suspected of having colorectal cancer will require which diagnostic study to confirm the diagnosis? You guys are already answering. Hey, one thing to remember, Chadwick Boseman, King T'Challa, our Black Panther, this is how he died. He died from colorectal cancer, okay? Was D right on the last one? Oh, what was it? I can't remember. Langley, I can't remember. All right, y'all, 10 seconds. 10 seconds. If you guys are new here, welcome. We're doing NCLEX questions. Got them off nurselabs.com. Yes, it was D. All right, thanks, Megan. I appreciate you. See, hey, Megan got my back because obviously I'm slow and I don't remember stuff. So, okay, cool. Awesome. Good. I'm glad you guys answered that. All right, here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. It is C, a sigmoidoscopy. Used to visualize the lower GI tract, a sigmoidoscopy and a proctoscopy, proctoscopy, oh my God, aid in the detection of the 2/3 of all colorectal cancers. All right. Do you help with trying to pass the HESI test? Shanice, I do not. I specifically do NCLEX. If I could clone myself to do each one, I would. But I specifically do NCLEX. Real quick, hey, commercial break. I appreciate everybody still rocking here with me. Make sure you guys participate, like, share, and follow. Hey, smash that like button. I see a bunch of y'all killing it down there. Y'all keep doing it. Y'all keep sharing it. You never know who is going to need this, okay? Don't troll my chat. I'm really sad that I haven't had to ban nobody today. But those individuals lucked out, all right? So don't be rude, all right? Nurselabs.com is where I got these questions. You guys can go over there and check them out for yourself. 7-day NCLEX course, as well as tutoring I do for NCLEX. You guys can check those links out. They are in my bio, and we're going to do an Ask Me Anything for about maybe half an hour after this, all right? Here we go. Okay, got it. Thank you. You're welcome, Shanice. No problem. Here we go. Question number 26. During a breast examination, which finding most strongly suggests that the LUZ has breast cancer? Is it slight asymmetry of the breast, a fixed nodular mass with dimpling of the overlying skin? Is it bloody discharge from the nipple, or is it multiple firm, round, freely movable masses that change in the menstrual cycle? What are we thinking? Sigmoid is where diverticulitis happens, left lower quadrant. Yes, sir. Yes, sir. Or ma'am, whoever you are. I don't know if you're sir or ma'am, or whatever you identify as. I don't. Whatever. But you are correct. Yes. Hey, if you guys are new here or just now joining, we're doing NCLEX questions. I'm actually about to answer this question. I want to know who you are, where you're from, where you're at in your nursing journey. Also, who's getting ready to take NCLEX? Who's getting ready to take it? Lorna, that name looks very familiar. I think you messaged me, right, Lorna? I think so. Differs from Simi, aka Flex. Yes. I actually used to work in the GI clinic, and we used to do those all the time. All right, here we go. Here's our answer in 3, 2. Have you ever worked in the cardiac ICU? Langley, I have not. I worked in a burn ICU, a medical ICU, and a neuro ICU. And the answer was B, a fixed nodular mass with dimpling of the overlying skin. A fixed nodular mass with dimpling of the overlying skin is common during the late stages of breast cancer. It says, me, I'm scared. I feel like I'm not going to know anything because my school used testing. Look, I just want to let you know I felt that same exact way. But here's the thing. At the end of the day, everything is your fault. So how are you going to fix it? So like, if you feel like HESI didn't work for you, now you have to go outside of all the stuff that was provided to you, material wise, and now you have to figure out how to get through it. All right. I'm just being completely honest with you because that's the same thing that I had to do for myself. Here we go. Question 27. A female client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites for cancer cells? Is it liver, colon, reproductive tract, or white blood cells? I just accepted a position as a tech in the cardiac ICU, and I'm nervous. It's okay to be nervous if you've never worked there before. The one thing I'll tell you, Langley, if you're going to go there as a tech, I would literally hang on to those find you a good nursing mentor in there. Find you a really good one and learn so much that you can from them. Because when you go that nursing route, or if that's the plan that you plan on going, it's going to work out so well for you. And then, hey, the next, you could have a job lined up, going to a cardiac ICU as a brand new nurse, right after you take your NCLEX, right? It says, what did you use when you didn't like HESI to study for the NCLEX? Look, I could, was it Ernisha? I used a lot. We had Board Vitals, we had HESI, Mark Klimic, UWorld, all different types of stuff, right? But, hey, I failed my NCLEX 3 times. And I tried to use HESI like the first 2 times the first 2 times a little bit, but didn't work. So it's all a mindset thing at this point. Sometimes it's not about the material. It's all about your mindset and how you approach it. But here we go. It says, my aunt works on the floor as of right now. They already want me to. Hey, look, that's what I'm talking about. That's called connections and networking, and I love it. Here we go. Here's our answer in 3, 2. Future labor and delivery nurse says A. And the answer is A. The liver is one of the 5 most common cancer metastasis sites. The others are the lymph nodes, lungs, bones, and brain. All right, so shout out to everybody that got that question correct. Physiological adaptation, which is the 3rd largest section on the NCLEX exam. Hopefully everybody can see that. I know that's a little tiny. So it says colon cancer with metastasis to the liver is classic. Oh, this kind of reminds me of? It kind of reminds me of like they used to have those dating shows and they used to have the captions pop up at the bottom. So med bitter, that's what that. It's like you kind of come in on the back end, as in like to kind of reiterate what the question is saying, but you put it in layman's terms. So I appreciate that. Here we go. Question number 28. Nurse Mandy is preparing a client for a MRI to confirm or rule out a spinal cord lesion. I appreciate you. I see you with the heart, though. During the MRI scan, which of the following would pose a threat to the client? The client lies still. The client asks questions. The client hears thumping sounds, or the client wears a watch and a wedding band. You know what? Sometimes these are that easy. These are not my questions, but hey, you never know. You never know, especially if you've never been put in a position to know that. All right. If you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. Yeah, this is too easy. Look, Sydney. Look, okay. All right. Okay. All right. Sydney, you about to get the finger because we both know that. We both know. Okay. Okay. Which said, I wish they were like this. Look, here's the thing. If you ever got a question like this on NCLEX that was this easy, you might want to think about what you were doing on your exam. Okay. The goal on NCLEX is to get to the hard questions and using critical thinking and clinical judgment. You need analysis and application questions, okay, to allow the use of critical thinking and clinical judgment. That right there, obviously, the answer is D. That is more memorization and remembering, right? Not analysis or application. That's what you want when you guys are taking NCLEX, okay? During the MRI, nobody should wear any type of metal, such as jewelry, being that a strong magnet field can pull them. Hey, I have a really funny story. Like, I had a pair of trauma shears in my pocket, and they were small. Didn't even realize it, and I took a patient on the MRI, and the damn machine yanked them shits right out of my pocket. And it scared the shit out of me because I thought it like went through me like some fucking movie. It was wild. It was wild. So check your pockets and everything, y'all, before you go take a patient down to MRI, all right? Here we go. Nurse Cecil is teaching a female client about preventing osteoporosis. Which of the following teaching points is correct? So what did the nurse say to the patient that was correct and the patient understands? Obtain an x-ray of the bones every 3 years is recommended to detect bone loss. B, to avoid fractures, the client should avoid strenuous exercise. The recommended daily allowance of calcium may be found in a wide variety of foods. Or is it D, obtaining the recommended daily allowance of calcium requires taking a calcium supplement? What are we thinking? What are we thinking? Shout out to all y'all that are still rocking with me. We got 55 people up in here. Hey, even if there was 5 people in here, we still going all the way. We still going all the way. All right. If you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys like, share, and follow. It says eliminate B. No one recommends no exercise. Facts. Right? Right. There we go. Here we go. Give y'all 5 seconds. Sorry if you guys hear my son again. He obviously wants to be the co-host to come in here and to act a fool. So, oh, Heather's here. Yes, Heather, I see you down there. Oh, I misread. Hey, RTFQ, Arnisha. RTFQ. All right, there we go. All right. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer, of course, is C. Arnisha, look, you just got there by the skin of your teeth. Sydney says Washington, D.C. graduated in December. Okay. Is every patient on a calcium supplement? No. Right? Hey, what's the best way to get those vitamins and minerals? Eat them, right? Eat them, right? Heather says, yeah, I finally got one right. Heather, we worked in the same ICU together. You better have gotten that right. All right. So here we go. Premenopausal women require 1,000 milligrams of calcium per day. Premenopausal women require 1,500 milligrams per day. It's often, though not always, possible to get the recommended daily requirement in the foods we eat. There we go. Supplement, aka supplement your diet is if necessary. You should have put if in big words. So I didn't notice it and said prevention at first. There we go. RTFQ, Arnisha, RTFQ. Here we go. Question number 30. Before Jacob undergoes arthroscopy, the nurse reviews the assessment findings for contraindications for this procedure. Which finding is a contraindication? Is it joint pain, joint deformity, joint flexion is less than 50%, or joint stiffness? What are we thinking? Shout out to all 63 of y'all. Appreciate y'all rocking with me. Heather, you better know this answer, okay? Just because you work hospice doesn't mean you could forget, ma'am, okay? What are we thinking? All right. All right, everybody screaming B at me. Screaming B. Give you guys 15 seconds. It's 15 seconds. That's why I'm here, always refreshing. I know that's right. Heather, I'm so proud of you. Hey, I'm giving Heather shit, y'all. Her and I used to work in the same ICU together. All right. Got some folks saying A. We got some folks saying B. All right, cool. All right, y'all. Here we go. Here's our answer. Our answer in 3, 2, and the answer is C. Joint flexion of less than 50%. Arthroscopy is contraindicated in clients with joint flexion of less than 50% because the technical problem in inserting the instrument into the joint to see it clearly. Other contraindications for this procedure include skin and wound infection. That's what I was thinking. Damn it. Look, did you pick that answer, Megan? No, you didn't. But that's okay, though. Reduction of risk potential. I believe it's 6 or 9 to 12% of the NCLEX exam. Well, good to know. Yeah, it's good to know, Heather, of course. So appreciate everybody answering that question. Yes, you got it. That's what I'm talking about. But that, ladies and gentlemen, are our questions for today. All 50 plus of y'all, I appreciate you guys rocking with me. Thank you for participating. I actually truly love all the love that you guys are giving, and I love doing this for you guys. I didn't have to ban nobody. I'm petty over 9,000 when I banned somebody, so I enjoyed it. I enjoy it, but I didn't ban nobody today. Like I said, I got those questions off nurseslabs.com. Check out the 7-day NCLEX course, as well as if you're looking for one-on-one coaching, mentoring, tutoring for the NCLEX. That link is also in my bio. But now I'm going to turn this camera around so you guys can look at my disgustingly hideous face, and you guys can start, asking me some questions. You asking all them questions, hating, assuming. How y'all doing? How y'all doing? I'm gonna hang out for a little bit. Say good luck, y'all. This isn't easy. Don't overthink it. Read questions first. Facts. Let them know. Hey, what's up, y'all? How y'all doing? How y'all doing? My name is Kevin. It's great to see, some of y'all that are in here. You're very welcome. You're very welcome. Hey, you guys can keep smashing that like button. You guys can keep following. You guys can share all that stuff. So now, just a little bit about me. Been a nurse for 3.5 years. What's up? What's up? Hey, hey, hey. Been a nurse for 3.5 years. Worked in the ICU, burn ICU, neuro, and medical. Worked in PACU, and I worked in the OR. So got a little bit of nursing experience, just a little bit. Been in the Navy for 16 years. Almost out the door. Almost out the door. So. Any tips for understanding disorders of the thyroid? Two of the biggest ones that you got to remember, two of the biggest ones that you got to remember, hypo and hyperthyroidism. What are the signs and symptoms? Myxedemic coma, as well as thyroid storm. And then understanding, once you understand those, that's the biggest aspects. That's the biggest aspects of thyroid disorders. What is the largest section of NCLEX questions? Management of care. And if you are if you're going for the LPN or the PN, it is coordinated care. They're basically the same thing, but you just got to know the difference between what you can and can't do and what you can and can't accept if you are an LPN. Who said active duty Navy? No, I'm in the reserves. I was active duty for 14 and I've been in the reserves for 2. So I'm currently in the reserves right now. Any tips for new nursing when writing notes? You're talking about writing notes as in when you're doing report and anything like that. Man, I used to have a template, but essentially you have to learn how to paraphrase. You got to write down all the things that are important. Don't listen to the fluff. Just got to write down all the things that are important. The times, what interventions or assessments were already done. That way you can go and reinforce them. Drips, medication, times for when people are coming by. So doctors, PT, all that good stuff. That's what I would recommend. I got a job offer at a hospital as a RPN, a resource team member. I'm scared. So resource team just means that you're in a pool, and they essentially, when they put you in different sections of the hospital, so that way you can learn different sections of everything that's going. So they'll put you in med surg, they'll put you in oncology, they'll put you in tele, they'll put you everywhere so you can get a good understanding of all the hospital. So that way, when they need somebody who's a float pool, they can pull you it makes you really versatile, and they pull you in different directions, such as they can put you on different floors. So that actually could work out very well in your favor. I knew for a fact I didn't want to be part of a float pool. I wanted to go to the ICU. And then I've been pulled from the ICU to go to different ICUs and to go to med surg. It could work out for you. It really could work out for you. So yeah, you're very welcome. No problem. What else do you guys got? A little bit about me. Like I said, I failed my NCLEX 3 times. I graduated in 2018. Failed my NCLEX in 2018, 2019. No, 2018, twice in 2019. And then I have finally passed my exam in 2020 during COVID. I worked in a burn ICU, a medical ICU, and a neuro ICU during the second wave of COVID, which is wild. It's wild. It's wild out here. I failed my NCLEX 3 times, now working on as an RPN. Shout out to you. Shout out to you. How many times can you take it? So I'm just gonna call you Miss Lady because your name is long. But Miss Lady, you can take it. It all just depends on your state. It all just depends on the state that you're in. Some states you can take it. You have unlimited amounts of time to take it. Some states only allow you 3 times before you have to do remediation. Some states will they say that you can do it for an unlimited amount of time, but you have a certain amount of time to do that. What days you here, please? What are you talking about? What days do I do this? I do this every Monday, Wednesday, and Friday. I'm from Niagara Falls, Ontario. Also, you're from Canada. Okay. All right. Is it Preet or Priet? How do you say it? Give me a 1 for Preet and then a 2 for Priet or Priet, if I'm saying it right. I like to, try to pronounce people's names. So I stay messing them up. I stay messing up words, but I really like to get down people's names. Preet. Got it. All right, cool. So you're from Canada. All right. I had a girl. There was a girl. She was from Montreal, who I knew. She's pretty cool. Pretty cool lady. So appreciate the rose. Happy lady. Thank you, man. Thank you. You're welcome. You're welcome. All right. What else do you guys got? What else could I say? But yeah, it all really just depends on what state that you're in. It really just depends on what state that you're in regards to how many times you can take the exam. Okay. So what else do you guys got? I usually go about an hour and a half with the questions, but the questions I went pretty fast today. So hopefully everybody had a good weekend. Use that for your BSN NCLEX. So let me clarify to you guys. You have your BSN is your degree. Okay. Just like you have your ADN, your BSN. So your associate's degree in nursing, and then your bachelor's of science in nursing, right? The NCLEX allows for you to get your license, which is either your LPN or LVN or RN. Okay. So when that happens, I can have an associate's degree in ADN and still get an RN license, right? So when I sat for my BSN, I got my degree, but the ADN and the BSN nursing degrees take the same licensing exam, if that makes sense. If that makes sense, smash that like button if it makes sense. And yes, that is the degree that I went for, and that I got because I was active duty in the military at that point, and the only way to become a nurse in the military is to have your bachelor's degree. Okay, the one you failed. I mean, like you didn't have to bridge. No, I did all of my prerequisites and then applied for a bachelor's degree program. Got accepted, went through the bachelor's degree program, finished, graduated. Then I went to my. Then I eventually took my test, passed it, got my license and all that good stuff. So Happy Lady says, I really respect the nurses that are at bedside. Thank you for what you do. I sadly burned out bedside. So I don't work bedside anymore. I don't. So I worked, like I said, I worked PACU. I work ICU, I work PACU, and I work OR. I still consider OR bedside because you're still patient care. And so I don't do bedside no more. And so now, like right now, I'm pretty much at home because I got hurt at work, doing bedside stuff. So now I'm at home, and that's what I do, right? And I plan on going back to work because I enjoy working as a nurse in the operating room. But as of right now, I'm home, recovering and all that good stuff. So becoming an NP, I don't want to be an NP. I'm actually going to school to get my master's in education. I'm going to school to get my master's in education. So what was the question? It says, pray for me in mental health, third quarter BSN. Mental health. So here's the biggest thing about mental health, Miss Lady, is it's therapeutic communication. And then knowing what your medications are, like your SSRIs, MAO inhibitors, even though they really don't use them anymore, but they're still in the curriculum, SSNIs, as well as the effects and how long they take to become effective for your patients. Those are big things. It says, what? Marie Anthony. I'm guessing you're asking me why. Like why I don't want to be an NP. Oh, it says good luck in education. You will do well. I appreciate that. Yeah. Nurse practitioner it was a thought. It was a push at one point, and I was like, no, I don't want to do it. CRNA was my big goal for a long time. And then I realized I didn't want to do it. Then I thought about, and then it really laid between informatics and education. And I stuck with education because I really do enjoy teaching. When I was active duty, I've been an instructor. My last stint on active duty, like the last 7 years, was me being a teacher. An educator, and I loved every bit of it. So that's where I hone in on. That's where I feel it, and that's where I'm able to give back to my community, which is that military aspect, and then also nursing now. So, what is the difference between RN and CNA apart from the pay? A license. Is it FAE? It's a license. If that answers your question, because as a nurse, you are licensed to do all different types of things. As a CNA, you are a certified nursing assistant. You don't have the scope of practice nor the credentials in order for you to do anything. So it's a very, very big difference. What is your rank? I'm an E6. I'm an E6. Learn lithium toxicity and therapeutic range. Facts, because lithium toxicity, talking about sodium, diet intake, all that good jazz. It says after RN, what else can we do? Any higher education? Absolutely. You can go and get your master's degree as a nurse. You can get your doctoral level degree as a nurse. You can get your master's in education. You could be a nurse practitioner of pretty much of any kind. You most definitely can do tons of different things and increase your level of education as a nurse. 100%. It says you will be great. I appreciate that. Critical thinking. It is critical thinking. It's very much critical thinking. Yeah. Thanks a lot, Kevin. You're welcome. You're welcome. Hey, for shout out to to the rest of y'all that are still, I think 23 people that are in here rocking with me. So hopefully everybody likes the fact that I do these questions. I do these questions usually Monday, Wednesday, Friday, around 5:30 Central Standard Time. That's what I do. As well as I do this AMA after that. And I talk about, hey, if anybody needs coaching for NCLEX, I've coached a ton of people. Right now, I have almost 200 people inside of my pre-launch for my 7-day NCLEX course. So for $48, they get it for a lifetime and they get all the updates. And right now I have a new generation NCLEX review that I'm editing on top of my 8 sections of of the client needs or the NCLEX pie that is getting recorded and edited as well. So I'm just saying, graduating here in the next couple months, or if you know somebody who needs it, it's there for you. It's there for you. So make sure you guys check that link out and those links out in my bio. It says, have you looked into MP? If so, why do they say it's not worth the pay? It depends on what type of nurse practitioner that you are. And here's the thing is that the money will come if you know how to navigate through nursing. That includes all aspect of nursing, not just bedside nursing. But you could be a nurse practitioner and then open up your own clinic. Like my son's provider, she's a nurse practitioner, pediatric nurse practitioner. She's fucking phenomenal provider, right? And now nurse practitioners can be independent. Now, if you try to go work like in a hospital, then that's a different story because hospitals underpay everybody. Now, if you try to go work, if you're a nurse practitioner and you want to go work at a group, then that's a different story because like if you work at a group like, pulmonary, women's health, like women's health, like for OBGYN or anything like that, then, that's where the money, like you get paid a lot more there. And then, of course, if you decide to do things independently, then that's different. It says how to get that deal, right? So, Kim, if you go to the link in my bio right now, you click on it, the one that's right there at the top, it'll say 7-day NCLEX course. It'll take you to the website. And then right there, the website, it'll say right there, $48. You get all the updates. You can scroll the website. It'll tell you the curriculum that's getting updated and that'll be in there, all that good jazz. And right now, my first phase of videos is going to be on 150 videos. 150 content videos to include getting the reviews. Okay. So they're coming. Hey, I'm a one man show. So I'm doing all this work, with the help from a couple of other people, but definitely trying to get it out there to y'all. Like this is like my baby. This is my baby. And I nurtured this thing just like my 19-month-old son in there. So yeah, that's what you get. You can definitely go over there and check that out. Marie Anthony says it's the best. What's the best? Working independently as a nurse practitioner? What are we talking about? Hey, if you guys are just now joining, we're doing an Ask Me Anything for nurses. If you guys are new, I want to know who you are, where you're from, where you were at in your nursing journey, and what questions that you guys have. I'm going to hang out here for probably about maybe another 20 minutes or so. Just depends on how many questions you guys ask. And, whatever I can answer for you guys. Make sure you guys share and make sure you guys follow and make sure you guys like. Like that is the 3 things that I need for TikTok to be like, hey, let's get this guy, folks looking over here. So have you ever looked into starting a birth center as an MP? Oh, that's a good question right there. Shout out to my man, Jason. Jason, I see you out there. Madison, I see you out there. But yeah. What else about me? I do one-on-one coaching as well. I actually am currently coaching 2 individuals. One actually just took her NCLEX today for her the NCLEX PN for licensed practical nurses, and we'll find out those results on Wednesday. Super proud of her. I definitely saw the growth. I saw the growth in her 100%. It says K Marie, okay, California. And I love seeing a man in this profession. Look, hey, 89% women. Nursing is 89% women with 11% men. I'm pretty sure I did my math right, but I don't be mathing sometimes. So the one thing I realized is that literally I've heard every woman say that they love seeing a man in the profession. But we are grossly outnumbered. But I enjoy being a nurse. I really, really do. And I've had some women that have taught me so much that I'm still really good friends with. And are really good mentors. Both of them are nurse practitioners. One's in acute care. Both of them are acute care, but one specializes in pulmonary and the other one in cardiovascular. So love them both, and I learned so much from them. So I appreciate it. It's nice to hear. It's nice to hear that, like, hey, we love you out here. So it's my dream, but I heard it can't in Ohio. Hey, if it can't be done in Ohio, Take them talents down to South Beach or go somewhere else where you can do it. All right. Don't, and that's another thing. Got to be flexible out here. Be flexible to where you can go and do other things. Go see the world. Go live somewhere else and try and live your dream. Don't feel like you got to be held down somewhere because you can't do something somewhere else. You know what I mean? What advice can you give about choosing between? Wait. What advice can you give about choosing between two questions? So you'll have a question that'll be one will be right and one will be more right. This is for Madison. The thing about it is, as you read the question, it depends on what the question is asking. So if it's a first question, we got to go systematically, right? What's the first thing, the second thing, the third thing, the fourth thing? What do I do? Now, if it's the most question, if it's like, hey, what is the thing that is the best thing that the nurse should do, or the most that a nurse should do? If I could only do one thing and leave, and that one thing would allow my patient to live and survive, what would it be? That's how you differentiate between two questions, right? What is the most important thing that I would need to do? If I could do one thing and leave, what would it be? Yeah, I know, and you're a brother, right? Look, I'm trying to tell you, I've been in places where I'm the only one on the floor, the only man on the floor, as well as the only colored individual on that floor. Can I say that? Yeah, that's right. Shout out to Jason. Jason, I see you out there. My man just started working in a cardiovascular ICU. Shout out to him. He's actually one of the people I coach. Let him know, Jason. Let him know how you doing out here. Ernisha says, what are some dead giveaway words that give answers away on the NCLEX? So I wouldn't say dead giveaway words. I would say trigger words. So trigger words like first, best, initial, right? So when you hear initial or first, I'm thinking based off of systematic, like what is the very first thing that I want to do, right? Or sometimes the word first, right? Or you'll have the ones that are like, what did the nurse say that was incorrect? Like the word incorrect. So what did the nurse say to the patient that was incorrect? So I'm going to have 3 correct answers, and then I'm going to have an incorrect answer. And of course, that answer is the answer that I want to choose, right? So I would say more that they're trigger words, but like first, initial, priority, best, those are trigger words. Don't change your answer. Hey, if you cannot articulate to me why you are changing your answer 100%, you better not change it. I want you to listen to my voice as I'm saying it. Listen to my voice as I say it. Kevin's like, don't you change that damn answer. Oh, so you basically just kind of answer my question. Yeah, okay, I see you. Hola, I got you. I always get down to 2 answers and I always choose the wrong one out of the 2. Kevin, is this, Kim Parker says, Kevin, I'm stupid to the internet. Repeat that. How I get to a lifetime. I'm looking. Oh, so go to the link in my bio and it'll be like right there under my profile picture. It'll say like Linktree or something like that. Click on that. Once you click on that, it'll take you to like a whole different other tabs. It'll say 7-day NCLEX course. Once you click on that, it'll take you to my website, and then you should be able to follow the prompts from there. Hey, you don't got to say that you're stupid. Look, I'm slow too. I don't math well. I don't follow directions well. It's all good. We all there. We all got there. Langdon said, my teacher makes us write a rationale before we are allowed to change our answer. Okay, I like that. And so here's the thing is like, that's what I tell you guys. It's you answer, like you do content. Content is so important. People, oh, you got it? All right, cool. Got you. So content is so important, y'all. Like people are just like, hey, I'm going to show you tricks on how to answer these questions, even if you don't know. I'm like, what? How? Make that make sense. Content, Q&A with rationales, right? And then reading and reviewing your Q&A. That is the way to retain that information. You have to do it. Also randomize your test. Never do it on tutor mode because your exam is not like that. Recreate the testing center. Don't have food, drinks, phone. Don't do nothing like that. Like, and I'm a big stickler on that. So people that get coached by me, you can ask Jason if he's still in here. People that get coached by me know that I don't play no games. I'm just like, hey, is that going to be in your test? They're like, no. And I'm like, no, why are we doing it? You know what I mean? Also from Georgia. Okay, Georgia. What tips do you have for HESI testing? Taking one next week. So the biggest thing that they give you, I believe it's like that it's the Saunders book or the Elsevier. That's literally where they get their questions from. And that's literally where I had to learn all of my stuff. Right. But then they have other stuff that's out there like Nexus Nursing is really good. They have a good amount of freaking YouTube channels that are out there. They have a really good. I can for the life of me not think of them right now. But just go in there and look at like HESI review. Go on YouTube and type in HESI reviews for whatever section that you're looking for, Madison, and they'll take you straight there. I have those. I'll definitely be reading them. Okay, good. right? And the biggest thing when you're studying as well, Mark Klimic is great. Mark Klimic is great. I recommend Mark Klimic for NCLEX, right? However, through nursing school, it helps too. But for NCLEX, for sure, I recommend listening to him when you're not physically in front of a computer. Like if you like listening to podcasts, audiobooks, or anything like that, 100%. And you can find Mark Klimic's stuff, audios on YouTube, but they get taken down all the time because it's copyright. He copyrighted them, so they get taken down all the time. But you most definitely can find them for sure. Like, because people have been taking his audios and have been selling them to people. Now that I don't agree with. Like, if you were just giving them to people, then that's different. But if you're out here trying to just grab that man's stuff and sell it, that's different. They are on Spotify. They're on Spotify too. I remember I found one girl on Spotify, and no lie, like a week later they were gone. I was just like, oh, okay. So you can find them on Spotify, right? And if you can find a way to download them to listen to like at your own leisure without anything like internet, I would recommend that as well, for sure. So, hey, how we doing? How we doing out here? Hey, looks like we're going to hang out for like another 20 minutes. What other questions do you guys have? If you guys are new here, welcome. I see Kat just joined back up in here. Shout out to you, Kat. I see you out there. What else you guys want to know? Hopefully, how was everybody's weekend? Anybody do anything this weekend? I live in Texas. I live specifically around, like the San Antonio area. They had a Worst Fest, right? Like Oktoberfest type deal up here in like the New Braunfels area, which is just north of San Antonio. So hopefully everybody will be able to have a good, nice week. Veterans Day is coming up. So shout out to all my vets that are out there, vets, active duty folks, right? Partake in those festivities, right? What's the most beneficial area to start as a nurse? Ernisha, that all really depends on where you want to go. You'll hear people say everybody needs to go to med-surg. First of all, don't you ever tell me what I need unless it's oxygen, right? Because I need that to live, right? But the one thing I will say is to go to where you want, go to where your heart lies. People will tell you to go to med-surg because it allows for you to get your time management, critical thinking, blah, blah, blah. But you can get all that stuff everywhere else. Or everybody will be like, hey, you lose your nursing skills. One thing about your nursing skills, you don't ever lose them. It's like riding a bike. Eventually, you'll pick it back up. It just depends on how fast you pick it up, right? So me, I went straight to the ICU. I did not pass go, and I did not collect $200. And I was happy with that. I was very happy with that. But I don't shit on med-surg because med-surg is a specialty. It is a specialty, right? Because it very well is. It says, I had my last clinicals for the semester today. Shout out to you, Langley. Now you could just go to Langley. That means graduation right around the corner. Oh, no. You said last semester, for this semester. Gotcha. I'm tracking. Ernesto says, I want to go to labor and delivery, but I can't go as a new nurse because they don't hire new grads. You have to go get experience. So I have a friend of mine who applied for a labor and delivery as well. And she had a year of experience and they still didn't want her. So honestly, if you want to go to labor and delivery, if that's where your heart is lying, I would still apply for them, but then also look at med-surg or look at your second area or your second choice that you would want to do for yourself. Think about that. I already knew I was going to the ICU. I applied everywhere. And then I got like 3 or 4 phone calls back and I was like, okay, well, we'll see how this works. But then again, I knew why. Is because, we were at we were at the beginning of the second wave of COVID. So I knew it was going to happen. And I learned a lot. I learned about vent management. I learned, a lot about hemodynamics. I've had pulmonary embolisms. Listen, I've seen so many of those to last me 2 lifetimes. I learned a lot. But yeah, you most definitely can do that. Hell, if they say, oh, I can't apply because I don't have, fuck it, apply. Keep going, keep applying. And then always have a backup plan. So yeah, go to med-surg. You can go to med-surg. There's nothing wrong with that. I'm not saying, and I'm not going to sit here and say med-surg is easy because people will be like, med-surg is easy. Not if you ain't ever worked. PE survivor here. Let me tell you, out of all the people that I've seen have pulmonary embolisms, I've had, I want to say 1 or 2 that survived. So shout out to you for surviving a PE because as somebody who has to take care of somebody with a PE, that shit is wild. It is wild. So, but what else y'all got? What other questions do you guys have for me today? If you guys are just joining, we are doing an Ask Me Anything in regards to nursing. We just did 30 nursing NCLEX questions, got them off of nurselabs.com. So we do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time. So if you guys want to be a part of that, you guys can of course, share. And then obviously you guys got to follow so you guys know when I'm doing it. Also, anytime I do these lives, they go up on my YouTube channel. So you guys will be able to get those in case you missed the live itself. Langley says, so my clinicals was in ICU, had a patient that was on a vent and not sedated. Is that normal? Yeah, you can have people that are like that. The biggest thing is like, hey, you'll see people that are vented. And usually if they're going to be vented and conscious, they're probably going to end up tracheing them at some point. She was just wide awake and chilling while on the vent. Yep. You sure can. They could do that because a lot of times they'll give them, they'll get paralytics, to help them, as well as, they get, other medications to help essentially like not sedate them all the way, but, essentially kind of keep them relaxed and chill. So that way they don't fight the vent. Right. That's the biggest thing. But biggest thing about ventilators is that they can't be on vents for long because that's how they end up getting, VAP, right? Ventilator associated pneumonia. So you'll end up seeing them getting switched from being on the vent intubated to getting a trach, right? So we want to try to eliminate that as much as possible. But yeah, you'll see, it's common. It's very common that you'll see that for sure. I actually had a lady who was in ICU who had a 2x4 go through her chest, like because she was riding on a motorcycle or something like that. And I don't know, like some Final Destination crap happened and whoop, right through. I'm like, it was like, like it's wild. It's wild out here. It's wild. So it says, I got into LPN school for January. What should I be prepared for? Red, I'm going to tell you right now, if you got into school and you start school in January, time management. Because I'm telling you right now, nursing school, your first semester, no matter if it's LPN or RN, you're going to get humbled real quick. All right. So my opinion or my suggestion to you would be to start doing your time management, like cutting people off, because you're really going to find out who your real friends are when you start nursing school, when you go through nursing school. I've seen so many people's relationships just fall apart. Yeah, we oversedate. Langley, yeah, we oversedate. Daily sedation vacations are standard of care. Avoid if able. Yep. What is myasthenia gravis nursing intervention? So you asking me what myasthenia gravis is, and you at what point? Ma'am? You asking me that? Right? Neurological disease. Neurological issue with myasthenia gravis. Right? And I'm going to say this right now because not saying I wouldn't be able to get it. I'll paraphrase. So it's a neuromuscular disease that weakens, that causes weakness to the skeletal muscles, right? So usually starts like in your extremities, right? Weakness, I'm about to sit and it's not clicking besides muscle. So it starts with the muscles that are connected to the bones, and they contract to allow the body movement. So usually you start getting numbness and tingling in your extremities that work its way up to the body, right? So it starts from distal to proximal, right? But then eventually, if you start having numbness and tingling and then those extremities stop working, but it's working its way inboard, what do you think is going to happen to the rest of your body inboard that's happening to your extremities? It says, hey, Kev, I'm an LPN, RN, scared going back to LPN after 14 years. I'm 47. What does that have to do with it? What does 47 have to do with anything? Your age ain't got nothing to do with nothing, boo. You out here doing it. Your age has nothing to do with it. Nothing, whatsoever. And if you're scared, go to church. Not just on Sundays, but Monday through Saturday. Okay? And I'm going to tell you this. You already been at LPN for a long time. This is something I really want, but it's really been so stressful. What's something that you want? I'm counting myself out. Why? So why would you count yourself out if you've already partially been there as working as an LPN? You're already a nurse. Now you're just going from a practical nurse to a registered nurse. You already got through one of them, so what makes you think you can't get through the other one? You know what I mean? Don't count yourself out. Put it this, hey, I'm all about words. I'm going to tell y'all something right now, all 25 of y'all. I'm all about words of affirmation. I'm all about putting it out there. I'm all about putting it out into the universe and the universe giving it back to me. But if you put it out there, it shall be so. Talk positively to yourself. I don't care how mad, how sad, I don't care. Talk positive to yourself. You have to talk. There's no one else is going to fucking do it for you unless you do it, right? You have to talk positively to yourself. And I'm telling you this as somebody who was always negative to themselves. Like, fuck it. If I fail this test, I fail. Fuck it. If I do this, I do this. Fuck it. Whatever. I still got a job and I can still do it. No. Because guess what? If I put all that negative energy out there, guess what happened? I failed my exam 3 times. And the one time I said, I'm going to pass this fucking test. I passed that test. in 60 questions because it was COVID. And I was done in an hour and 5 minutes. And then I got a license. Stop playing. Don't do that. Don't do that to yourself, because the moment that you give up on yourself, the last person that should give up on you is you. All right. We are unsuccessfully successful around here in everything that we do, not just being a nurse, but on everything that we do. All right. So he's like, I know, but it's a mental thing. Facts. It is very much a mental thing. So now, before you even start your program, get in the right mental state. Keep all the negative folks away from you. Keep all the stupid people away from you. Keep nothing but positive things around you. Hell, if you need to come here 3 times a week for me to tell you to get it the fuck together, ma'am, I surely will do it. I surely will do it. Ask everybody that comes into my chat. I don't be playing them games. I like, you better start talking. You better start talking right to yourself. You only got one you. So be nice to yourself. Be kind to yourself. All right. This is like, yes, I need to get it together. Get it together. All right. It says, I really want to finish school, but it's been really hard. But what is it? But I can't. I really want to finish school. How about we change it? He's like, hey, I am going to finish school. I study how I used to. Funny thing is, I tell other. Yeah, it's just like, you can't take your own advice. Trust me, I've been there, but now I take my own advice all the time. Now, can't nobody sit here and tell me different at all. It says nursing school switches up studying from memorizing to critical thinking at the end. Facts. They do. Because they want you to start thinking like a nurse. You have to learn, like, the demand for nursing, the demand for the field of nursing, and your knowledge is different. It's very different than how it's been over the last, years before this, right? They expect a lot out of you. And a lot of times, like, you have to know these things because we're not the only ones that are taking care of the patient. Doctors take care of the patients. Sometimes doctors make wrong diagnosis, or sometimes doctors prescribe the wrong medication. I cannot tell you how many what do they call them? Close misses or near misses or whatever that I've had to catch because the doctor wrote the wrong prescription. They were like, yeah, let's give him 50,000 units of heparin. I'm like, what? I'm like, so you must really not this person. You must really like, what are we doing? So I call him. I'm just like, hey, so did you know you put an order in for 50,000 units of heparin? And he's just like, oh, did I? Hey, man, that's a good catch. I appreciate that. Like, it's been a long day. Now, imagine if I would have gave that $50,000, that 50,000 units of heparin. Imagine what would have happened. You see what I'm saying? That's where the critical thinking and the clinical judgment happens. You have to clinically, and you guys are going to learn this as you start to gain confidence when you're taking care of your patients and then you're conversing with doctors. All right. I don't let people play with me. I don't let people talk to me like they're crazy. If I'm wrong, that's cool. If I'm wrong, I'll admit that I'm wrong. Right. But you're not going to talk to me like I'm not a human. Like, you're not going to berate me. You're not going to do nothing like that, because you got to leave work. You got to leave. I'm just saying, hey, don't let people play with y'all. OK, crazy part is that I don't want to work in a hospital. I want to be mental health nurse. I don't even know how to say your name. Is it Bazooka Bria? Bazooka. I'm just going to say Bazooka. You could be a nurse and then go work straight in a mental health facility if you want to. Clinicals is teaching me that too. Yeah, clinicals will teach you clinicals will teach you how to do critical thinking, clinical judgment, and how to converse with one another. That's exactly what it'll do. 100%. Just call me Bree. Okay. Bazooka. Is it Bazooka though? Is it Bazooka? Am I fucking it up? I'm messing it up. I'm sorry. I'm sorry. I'll call you Bree though. I got you. But yeah, you most definitely can go work in a mental health facility right after school. Like, they take brand new nurses. Actually, there's one girl that I know. She had been a nurse for 3 years or 2 years. I'm sorry. Went straight to a mental health facility. It's like, no, you're actually saying it right. Oh, Bazooka Bria. Oh, okay. My bad. I'll just call you Bree. Maybe you should just put your name as Bree. That way people are like, is your name really Bazooka? Hey, I'll just play it. Shout out to you. I'm good on critical thinking, but my clinical judgment is trash. So here's the thing about critical thinking. They go hand in hand. They really do go hand in hand, for sure. Right? So based off of your critical thinking, you have to make a clinical judgment. Right? So if I'm sitting here and I'm thinking, I'm like, okay, cool. this guy has, he has a congestive heart failure. I know he's going to have, not wheezing. He's going to have, a pink frothy sputum. He's going to have edema in his extremities because he has too much fluid, right? My ventricles aren't doing what they're supposed to be doing, blah, 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 yada, yada, all that good stuff, right? So with my critical thinking, I'm just like, okay, now how best can I help him? Well, he's having a breathing issue, right? So I need to get all that fluid off of him. So I'm going to give him some type of diuretic to get that off, right? So now with that diuretic, all that fluid's coming off. Now my clinical judgment aspect is just like, okay, now what am I going to expect from this specific outcome, right? Is this guy bedridden? So he's going to be peeing all over the place. Am I going to give him something? Right? Am I going to give him a Foley? Am I going to give him a urinal? Can he walk? Can he ambulate to the bathroom? Can he do all that? Did you let him know, hey, I'm about to give you this med and you're going to be peeing all over the place, right? And, like that's the judgment aspect that you have to be able to relay. Okay, now is it a K wasting or a K sparing diuretic, right? Yeah, crackles bilaterally, right? Because now it's a breathing issue. So now you have, based off of what interventions that you are going to do, you need to be able to realize what the outcomes are going to be. But then you also need to know is what is unexpected, right? So if I'm wasting potassium, I'm going to be like, maybe I gave too much. Because now his EKG is looking kind of funky, right? So now I got to be like, okay, what am I going to do next to try to fix that? Do I got to replace his potassium? Stuff like that. Do you have study guides or anything from MedSurg? I do not, Bree. I don't have anything. If you're talking about MedSurg, like in school, I do not. However, I am working on, when I tell you I have curriculum that is going to last me for a lifetime right now, I have curriculum that is going to last me a lifetime. You hear me? So that aspect, I actually do have MedSurg curriculum that I will be recording. I just got to get all my stuff taken care of. So, but yeah, that's coming. It's going to be a while. Will I have to study every day for LPN? If so, what is the recommended hours of studying red? It all just depends. And yes, you're going to study. When I tell you, when you start school's going to be your life. And let me tell you, your first quarter or your first semester of school, that's what they call that. It's going to humble you. And that's what they call the weed out. They're going to see who's serious about being there. Right. So you'll figure out how long. Some people say 20 hours a week. I can tell you right now, when I was in my first semester of school, it was not 20 hours. You might as well just double that. It was like having a second job. Literally, it's like having a second job. Like the answer will be weigh the patient daily, but I'll check for fluid restriction compliance. Well, here's the thing: is like if you have somebody with congestive heart failure, right? The biggest thing is just like, hey, they gained 2 pounds over 24 hours. That's not good, right? I don't care about fluid restriction apply. I mean, is that important? Yes, but what's more important? What's more important, right? So okay, that's great. Let me know. That's bad. Bree, what are you talking about? I'm lost. Hey, if you guys are just joining, we are talking nursing. Ask me anything in regards to nursing, NCLEX, all that good jazz. I've been a nurse for 3.5 years. I've worked med-surg. Oh my God. I've worked ICU, I've worked OR, and I've worked PACU. So if you guys have any questions in regards to anything like that, go ahead. Feel free to ask them. I'm going to be on here for about another 4 minutes. And then your boy's got to get off because he got content he has to record and edit for y'all. So for all those people that bought the course. But it says if they gain 2 pounds, they have a HF. Yep. Fluid overload. There you go. Absolutely. So that's what I'm saying. It's just like is for somebody who has fluid volume overload, do I want to make sure that they're on fluid restrictions because they're just going to get more fluid? Yes. But what is more important, the restriction or the fact that they gain 2 pounds? Okay, Kevin, thank you so much for answering. God bless you. Preet, thank you for being here. Hope you follow. Hope you share all that good jazz. See you next time. Have a good rest of your week. Anybody that's taking their NCLEX all this week, sending out good vibes, sending out love. You guys are going to do great. The gaining 2 pounds. That's important. Yeah, that is important. So like, what? Okay, both of them are right. But which one is more right? Which is say, hey, we have to do daily, like you guys have heard the strict I's and O's, right? Strict I's and O's. That is why, because if my patient's gaining 2 pounds, I'm going to be like, why are they gaining 2 pounds? Think about if they were gaining 2 pounds just like that and they have fluid and then they're bedridden and they can't go anywhere, right? Or they're intubated and they gain all this weight. right, from all this fluid. So now what does that increase? The chances of what? If they're intubated, if they're sedated and intubated, and you're giving them all these fluids, and now their extremities are blown up like balloons and they can't move, they're at risk for what? They're still at risk for this, but they're at risk for, what? Fluid overload, right? But then also think about those, clots. Clots is huge, right? But then also we're thinking about pressure injuries, pneumonia, right? That's where your critical thinking comes. Like, think about it like if your alternator, if anybody understands cars, if your alternators went out in your car, with one thing that'll go out, the rest of the things will start to go out. Or like those little electronic microchips. If it fails, your whole car or vehicle will shut down, right? You got pulmonary edema. Yep. So you got so many trends that can happen. So many things that can happen. Congested lungs, right? So we're thinking of like, crackles, fluid on the lungs, pulmonary edema, right? Exactly. Their vital signs will be off too. Yep. Right. So here, and also think about this. If the vital signs are going off, right, first thing that you want to do is that you want to look at the patient. You want to look at your patient. It's just like people before paperwork, patients before equipment, right? Fluid in the lungs. Absolutely. Right. So, but then also we're thinking like if you have somebody who has fluid volume overload and they're sedated and intubated, and like I said, all that fluid's going toward, like, hey, think about gravity for somebody who's sedated and intubated. They're very prone to pressure injuries, right? Administration of oxygen will help be needed. Yep. It could be depending on what the issue is. Okay. But that's it for today, ladies and gentlemen. I appreciate everybody for stopping by. It is now 7:30. Your boy has got to get off and go not play, but go be dad, all that good stuff. So once again, I appreciate everybody for being here. Hey, you only got one you, so take care of you. All right. Say and be positive to yourself. If no one else in the fucking world is going to do it, the last person to do it is you. That is the last person to do it is you. It says, oh, I like this life. Thank you. You're welcome, Bree. I got you. Also, last plug, 7-day NCLEX course. It's in its pre-launch phase. It is going away on Black Friday. It's going away on Black Friday. And you get all the updates as I update everything. Okay, so I'm just want to let everybody know that for $48, you get a whole content like course. And every time I update it, you get it. And that's only available to those people that got the pre-launch. So make sure you guys go over there and check that out. If you need tutoring for NCLEX, I do tutoring, one-on-one tutoring. We go through questions. You get an hour plus with me. Like we create a calendar, we create a tracker. You get tons of motivation. Like how I am like this, you get this one-on-one. So if you think I'm not about the games here, trust and believe me, when you have me one-on-one, I ain't about it either. But I'm your biggest advocate. Trust and believe me when I tell you that. And then also we talk about nursing mentorship. So somebody was talking about, hey, I want to get to labor and delivery. I was like, hey, think about this, think about that, think about this, thinking outside the box type stuff. So yeah, those can be checked out. You can check those links out in my bio. Okay. Misha, what's up? You just missed us. We're about to log off. So like I said, be kind to yourself, love yourself. Good luck to everybody that's out there that's going to be taking their exam here in the next couple days. And I will see everybody on Wednesday at 5:30. So until then, bye.